Department. We have Deputy Health Officer Holly Flickinger and Lead Hygienist with Smiles on Wheels, Kaci Howard. Good morning.
Morning.
Good morning.
I think hygienist. People say it differently.
It's
don't they?
hygienist.
How
It's
do you say it?
hygienist.
It's
Yeah,
hygienist?
and I've actually
Hygienist.
never heard it the other way.
Hygienist.
Are you serious?
Yeah.
I do think we're kind of genius. I will
Well, there
say.
you go. I've never heard that.
Well,
Have you, Brandon?
Hygienist?
Yeah.
hygienist.
No one's ever heard that.
Hygienist?
Yeah.
I've always had a hard time with that. So oral health, that's one of the things the health department's concerned with, particularly with little ones.
Yes, yeah. So within the last few years, we've implemented our kindergarten oral health program. We contract Smile on Wheels, and they do a sensational job for us. But the kindergarten oral health program essentially says that children entering their kindergarten year need a screening
Wow.
or an assessment, I should say.
Yeah, an assessment. So that actually just passed a new law for us in Michigan. So it is now a requirement mandate for every child entering school that they will have oral health, vision, hearing, and of course their immunizations. So it is going to be a new sector for this upcoming 24-25 school year for parents to be aware of.
And how important is oral health to
Incredibly.
the child's overall health?
Incredibly. I mean, it's part of our body, obviously all linked together, but we do see just a huge decay. So we're fortunate that Jackson County was one of the first partners with MDHHS in the pilot program for the kindergarten oral health assessment. So this is our second year doing this. So, but we're seeing just under a 40% decay rate in Jackson County, and actually statewide.
What does
What is
that
that?
mean?
40% of the children that we're doing assessments on,
Okay.
just under 37%, have active decay in their mouth.
Okay.
So
Wow.
it doesn't mean that they're all urgent cases.
Sure.
Urgent is pain, infection, swelling. You'll see some of the photos that we've taken. These are actually from our patients in Jackson County.
Kaci, are you seeing a lot of students that this is their first screening in general?
Yes.
These don't look good.
They're not good at all. So
But it's nice that you guys have this opportunity
We
to
do.
partner together
We
to
do.
provide some care.
it is, and it's just a wonderful service to be able to offer to the community. So
What are we seeing here? That's just a
this
broken
is
tooth?
actually 2 teeth and decay. They call these kissing cavities. So when the teeth are close and touching, decay can start on one tooth, and because they touch, it will spread. It's an infection, bacteria, so it will spread just like an infection would anywhere else in our body. So it ends up affecting 2 teeth. So that was decay on 2 teeth.
Is this the same thing?
This is actually a severely decayed tooth that's decayed all the way to the gum line, to the gum line.
Are these kids in pain?
Yes, they can be in pain, swelling. That's another concern why this bill was also introduced and thankfully passed, because a lot of children are missing, school hours. They report 51 million nationally are missed per year annually due to dental pain, school hours. So yes, it does. It affects it. They're not sleeping well. They're not eating well. They're not able to focus at school. So
And then you think of how that affects learning and
Right.
learning barriers and some of those kinds of things as well.
Yeah, I mean, you think
So-
about mouth pain. Anyone who's had
Oh, it's
mouth
nothing
pain,
worse.
I mean, it's just so
Yes.
distracting to your life, right? What's the screening process like for these children?
Very simple, actually. It's if you ever had your hearing or vision checked, it's literally you open. We
Yeah.
use a light. We look in your mouth, and that's it. It's literally less than a minute. Non-invasive, very simple, very easy. So this is not a dental cleaning. We're not placing fluoride. We're not doing sealants. It's simply an assessment only. So.
And what's the location that you guys do this at?
We are actually, like we said, in partnership with the health department. So we also provide through our Smiles on Wheels WIC services. So there are open hours at the health department during that time to have the assessments, and then school-based. So we are actually going into the schools during school hours, which also makes it very convenient. For the children and the parents. That way they're not missing, they're maybe out of class for 5 minutes. We work collaboratively with the hearing and vision, so it's all done at one time. So they get their hearing, vision, and oral health screening at school.
Also some community outreach. So, kindergarten roundups is a place that we go. There's
Head Starts, daycare centers.
Yeah.
There's back to school events, there's the back to school blast, other Jackson community events, church events. We do a lot with Smiles on Wheels.
Holly,
We're in
you're
the community
so
a lot.
involved with kids getting back to school, and we think about that. It's amazing how many services you provide. Just talk about a little bit some of the services when it comes to these kids.
Yeah, so we have a lot of school-based services. As Kaci said, the kindergarten oral health is new this year. Then we have our hearing and vision. We have our immunizations and waiver program. And then we also have some services that support older age students. We have a middle school program called Empowering Youth Today and our high school based program. It's called, we call it the Teen Pregnancy Prevention Initiative, but we teach a curriculum called TAP, or the Teen Outreach Program, and then we have subgroups that do some community service and community-based work as well.
Now it's Smiles on Wheels. So there's like a van you drive around, right?
We have multiple, but we are also a school, particularly a
Right.
school-based program, but we do a lot of services. We work very closely with the Delta Dental Foundation. They are huge supporters of us, so thank you, Rick Lance, for all of your support. But yes, they are huge supporters, so we actually do some senior-based grants. We are just out in the community doing a lot of different things, but in Jackson area, we are in many schools providing dental cleanings, sealants, assessments as well, and fluoride treatments. So.
Now, hearing and vision, you can't do anything about that. If you're a parent, it's like you've got your child with a hearing or vision problem, they were born with it likely, right? But dental problems, there's something people can do
It is.
to improve that at home.
It's our #1 childhood disease that is preventable. So, but it's number one.
Talk a
so.
little bit about not waiting, right?
Yes, yes,
The
please.
amount of damage or repair that you'll have to do will just increase. So it is not
Absolutely.
okay to wait.
So again, working with the health department, it's so important when you do have little ones. The WIC program, you can come in and have assessments and fluorides and just the referral partnership that we have.
Right.
So not only is it about doing the assessments, and finding the potential need, but it's finding a dental home, helping the families and the children with care, insurance, different, like you said, just different resources for them.
Yeah, I think people think, oh, they're just baby teeth; they'll fall out.
Well, I think that's probably what people think. Oh, their baby teeth are going to fall out. They don't matter.
Right.
Yep, it can affect the adult tooth, and then it affects other things as well. Obviously, like we talked about earlier, the learning, their speech, developmentally as well, could be nutrition. Maybe they're not able to eat the proper food, so developmentally as well, just overall body development, it can affect a lot of different things as well.
Did you know Michigan was the first state to put fluoride in drinking water?
I did, actually.
Wow, how about that?
Yeah, in some states there are people that are saying, we don't want the fluoride in the water anymore. That could be devastating to a family's health.
It definitely could be. It definitely could be. It's important.
Andy, I think you have a gift for all our guests today.
Do I? Oh, yes, I'm giving gifts to the home.
Yes.
I'm giving tickets to the Home Builders Show.
Oh, thank you.
Very nice.
This is
Thank
great.
you
Yes,
so
that
much.
is a very nice party
Thank
gift.
you.
You're welcome.
We
Thank you.
appreciate it.
Did you want one too, Bert?
Thank you.
You're welcome.
We can go together after the Richard Marx concert.
There you go.
Yeah,
Are you going?
you want to, we can give you. We can
I'm
give
right
you
now.
those too.
We can get you into that as
Yeah,
well.
those. Yesterday we had biscuits.
Ooh.
Yes, we did. They were delicious. They were.
Well, great to see you both. Thanks for all the work
Yes,
you're doing.
thank you for
Yes.
having us.
Yeah, keeping
thank you.
our community safe and new. If you've got a kindergarten, you'll be seeing some new things this year. So that's good for you and your family. These are some of the details on oral health and all the other things needed to get ready for K. Thanks to Deputy Health Officer Holly Flickinger and lead hygienist, Smiles on Wheels, Kaci Howard. More of the morning show after this.